I'm Dr. DiPietro. I am the Director of MRI here at the Washington Health System, and I'm a radiologist, which means I'm a specialist in diagnostic imaging through the system. I'm involved in all facets of diagnostic imaging. Now, I've been asked to talk to you a little bit today because we're going to be bringing a new and exciting modality to the radiology department, specifically the MRI department, and that's multiparametric prostate MRI. Prostate cancer, unfortunately, is the #2 most common cancer among American men. Even more unfortunate, the #2 cause of cancer death in men is also, unfortunately, prostate cancer. So if you break that down, according to the American Cancer Society, approximately 1 in 8 men at some point in their lifetime will be diagnosed with prostate cancer. So in order to combat this, the American Urological Association recommends that men get screened for prostate cancer. Typically, men who are between 55 and 69 years of age have a discussion with their healthcare provider about being screened, the PSA, which I'm sure many of you are familiar with, in their rectal exam. Now, should this come out as abnormal, usually you're referred to a urologist and you get further workup. Now, traditionally, that workup has involved a systematic but not targeted biopsy of the prostate. In other words, your prostate is biopsied in a grid-like fashion, taking samples from each area. And that is good, but now we can do better. So with the power of the new multi-parametric prostate MRI that we're going to have, we're going to be able to provide your urologist with a 3-dimensional map of the prostate. And on that map, we're going to be able to tag the areas of highest suspicion for not just prostate cancer, but in particular high-grade and potentially lethal prostate cancer. So traditionally, they had done the random biopsy, but now they're going to know exactly where to go on that biopsy. Now, I've seen some literature, only as much as 1% of the gland can be biopsied under that systematic approach. If you have a patient who already has prostate cancer that's been diagnosed, we can then use the MRI to more effectively stage the cancer. And that's an important part of treatment. We're going to be able to know if it has passed out of the gland, has it moved into the pelvis, involved the lymph nodes. In particular, the vascular bundles or the nerves that are feeding the prostate are important to know, and the seminal vesicles, which carry fluid away from the prostate. Now, a certain number of men are going to have an abnormal PSA, or they may have a continually rising PSA, but they have no diagnosis of prostate cancer. They've gone under biopsy maybe once or twice, and that biopsy has come back as negative. So that's a real diagnostic dilemma, because what do you do with those people? Do you treat them aggressively, or do you treat them conservatively? Now, prostate cancer is a lethal cancer, as we discussed, but there's also a large subset that is not particularly dangerous, and over-treating can cause just as much problem as under-treating. Now, in those men, if the literature shows if you bring them back and do a multiparametric prostate MRI, targeting the most specific areas of concern, up to 40% to 41% of those men will then be diagnosed with a high-grade prostate cancer that requires treatment. So, how are we able to do this? Well, we've developed so far in the field of diagnostic imaging, in particular MRI imaging, that we're actually able to observe water molecules in real time. In a very simplified manner, water molecules that are inside of a prostate cancer cell behave in a very different manner than water cells that are in a normal tissue cell. We're able to actually map that out in real time. And that's the power of the multiparametric prostate MRI. Actually, it's very non-invasive, it's very easy to use. So just like any other MRI, you'd come to the department, you would have an IV placed just to inject some dye, and that's the only that is the only invasive part of the procedure. Some areas, they used to use an endorectal coil, things like that, and we do not require those things. You come in, you lay still, and there's no difference between having an MRI of your head, or your foot, or your knee, or now your prostate. September is Prostate Cancer Awareness Month. I would encourage you to speak with your primary care physician, see if you meet the criteria to be screened, If you do, hopefully everything comes out fine, but should you need additional workup, please consider one of our excellent urologists here at the Washington Health System. They can evaluate you as needed, and should you need this new technology, they will very soon have access to it. Thanks very much for your attention.